my name is Amanda Cruz, and this is my speech on schizophrenia, and this is my audience. Hello, audience.
Hi.
Okay. So now we are officially getting started. So let's talk about it. How many of you have ever been anywhere, seen someone out in public, they're talking to themselves, maybe they're staring at something you've never seen before? I mean, I know I've been out in public. It's very scary. Don't do that. So schizophrenia, it occurs in 1% of our general population and can occur up to 10% of our population when they have a family history. So mother, brother, sisters, anybody that's first relation, 10% increase. So one of the reasons I became interested in schizophrenia is I was introduced to this topic in Intro to Psychology. And as part of that, I wanted to learn more. I wanted to know how it affected people. And I wanted to talk to my colleagues, do some research, and see exactly what the clinical knowledge was to understand these individuals more. There are 4 types of schizophrenia. There's 3 main types we're going to talk about today, though. So the first type is going to be disorganized schizophrenia, catatonic schizophrenia, and paranoid schizophrenia. Now, I know that seems like a serious disease, but let's take a look at how each subtype can be characterized, and hopefully we'll make this easier for you guys. So let's start with disorganized schizophrenia. This can be characterized by incoherence, grossly disorganized behavior, bizarre thinking, or flat or inappropriate emotions. So people who generally, you can't tell what they're thinking. It develops usually in adolescence or young adulthood and can be marked by silliness, laughter, bizarre, or obscene behavior, and that's not pretty. So risk factors include genetics, viral infections, any fetal malnutrition, stress, or if you do drugs, you can become schizophrenic. So let's talk about diagnosis. There's physical exams, blood work. There can be MRIs of the brain, EEG monitoring, which monitors your brain waves, or even a psychological exam by a psychologist. According to Medical News Today, their patients must present with disorganized speech and behavior, lack of emotion, and inappropriate emotions to be diagnosed with disorganized schizophrenia. Very scary. So, while disorganized schizophrenics may make themselves known by silliness and bizarre behavior, catatonic schizophrenics may become completely rigid and violent. So let's talk about catatonic schizophrenics. Catatonic schizophrenics are defined by extremes in behaviors marked by stupor, rigidity. They tend to be very unresponsive posture. They can be mute, or sometimes they can be agitated and have purposeless behavior. So let's assume they have bizarre body behaviors. Maybe they have unusual limb movements, or they perform actions repetitively. These are classic symptoms of catatonic schizophrenia. Risk factors include genes, and much like those of any other schizophrenic, risk factors include viral infections, fetal malnutrition, and stress and drugs. Schizophrenia gene is most studied, controlled form of birth. It controls the birth of new neurons that lead to brain circuitry. So by having schizophrenia, your neurons can add to your brain, causes things to go haywire. Diagnosis can take a long time. And usually statistical manual of mental disorder shows that you must meet the criteria: inability to move or speak, stay still, overly excited, resistance to being grimacing, maybe you're agitated, irritated, you don't want to do anything, and that's classic signs. The paranoid schizophrenics is the most common disorder. They have delusions, people are there, they're hearing things that aren't quite there. So if you ever hear someone talking to themselves, they might be responding to a voice they're only hearing to themselves. According to Medical News Today, key changes in brain function include perception, emotion, and behavior. And this leads experts to believe that paranoid schizophrenics have the biological site is in their brain that causes this disorder. Blood work, MRIs, EEGs, they can all lead up to diagnosis. A physical exam and also a psychological exam will help doctors to diagnose a patient. According to the Diagnostic and Statistical Manual of Mental Disorders, a patient must have a preoccupation with at least one delusion and presence of recurrent hallucinations. So I know this was a lot to take in. I'm sure you guys are a little overwhelmed. So let's just conclude this speech. So let's talk about it. 3 main types of schizophrenia are disorganized schizophrenia, catatonic schizophrenia, and paranoid schizophrenia. Again, this affects 1% of our general population, but can affect up to 10% with a family history of schizophrenia and a first-degree relative. So your mother, your brother, your sister, they could all be affected. So the next time you see someone that's out and about, maybe they're talking about themselves, maybe they're just talking, staring off at the wall, and you don't know what they're talking about, just remember they might be suffering from schizophrenia, and be nice, be kind, and be patient, because you never know who could be suffering. Thank you guys, and have a great night. This is my speech. It's the end. This is my audience. Yay!